Good afternoon, Miss Sherry.
Good afternoon, Sarah.
So what brought you into our office?
Originally, it was lack of sleep, physical pain. I'd been every doctor, everything I'd tried before, and I just gotten to a point where I wanted something different.
So how long had you been dealing with this pain? How long were you not sleeping?
I got hit by a city water truck in my 20s, and oddly enough, I didn't even feel the pain until my mid-30s. And so at that time, I thought, well, I'm going to try massage therapy. I'm going to try chiropractor. I'm going to try stretching. I'm going to try everything. And they were just little Band-Aids, They wouldn't, and a few days later, I would just feel terrible again. And it wasn't until I was probably about 46 that it had gotten so horribly bad that I went to my regular doctor, I guess you'd call my MD, and of course the first thing they want to put me on is antidepressants. You're depressed, that's why you can't sleep. You need pain medicine, you need this, you need that. And although I refused most all the medicines, I did end up taking a small muscle relaxant, and at that time it was classed as a non-narcotic pain medicine. So over the last 6 years, I've been using that, and all the side effects are terrible. I absolutely hate it. I have a bubbly outlook on life, and it's like a shadow. Medications just like put this shadow on your whole life, and it was horrible, just terrible.
So this pain was definitely affecting your life as far as, your personality, your physical pain. It sounds like every aspect.
Every aspect. Pain is awful.
So what kind of treatments did you go through here?
Well, the very first thing they did is sat me down and do an assessment, and I really loved that. I love the effect that they saw me, or y'all saw me, as a whole person, from head to toe. What makes me tick, what I like doing, who I am, why is, how is my life affected by the pain? I love the entire assessment. And not only was the pain so bad, but I'm 52 now, so of course, a couple years ago started all the menopausal symptoms, all of that. And so I refused all the hormone replacement therapy because of all the cancer in my family, and I just did it white knuckle, but I just had no bounce back because of it. Previously in your 30s and early 40s, even though you're not sleeping and you're in pain, you've got that little bit of bounce back. So I had none of that left, none of it. So we started there. We said, let's look at your hormones. Let's go ahead and let's do some testing. And sure enough, of course, my tank was empty. So we just started on a very light course of action. I believe it's testosterone, and already just that little bit has helped, I believe, my sleep, definitely. So that was, very important to me. And of course they'll go over things with everybody, but I was considered phase 4 in my neck injury. So without some type of chiropractic adjustments, physical therapy, the testosterone was only going to do just a little bit. I mean, without having to address, when you have such a compression and the discs are non-existent and the bulging nerve pain, your body is just vibrating with pain constantly. And there was no way I could get any kind of restful sleep. So we immediately went into that. So we went into the hormone, the chiropractic adjustment, and the physical therapy. Well, not all that is going to hold, in my opinion, if I wasn't on such a good diet already. I gave up table sugar 3 years ago. I don't eat any kind of chemicals. I'm on a whole foods, plant diet. That is, part of the foundation of a good, healthy person, I believe. And then we went into some of the other therapies, which was the ozone therapy, the lidocaine injections. And again, without that, I don't know that I would be able to even get through the physical therapy. And if I couldn't get through the physical therapy, I don't think the adjustments would hold. So I think head to toe, if I wasn't doing all of it, I just don't know if I'd already be where I am. And I'm already so far ahead of where I started.
So it's been 2 weeks.
I can't believe it's only been 2 weeks. 20 years, 2 weeks. I'm blown away.
And how are you feeling?
I'm blown away. I am just, you just can't remember what it was like to, the pain I can't say is resolved 100%. I can say it's already 50% better. I can say my sleep is probably 65% better. I mean, that's remarkable to me in 2 weeks. That is remarkable to me.
Definitely, Ms. Sherry. So how would you say that your experience has been here in our office?
A+++, million, trillion, highly recommend it. Anybody that could ever just come in for the assessment, come in for the discussion, take your health in your own hands. Don't give in. Don't get in the antidepressants. Don't get on the medication cycle that then you just have to get off of. And don't just try it. Just come in, talk to the case managers, talk to everyone here, and I just know if it could work for me, it could work for anybody.
Thank you so much, Ms. Sherry.
Thank you so much.